My name is Melissa Trudinger and I'm one of the writers from the APA's In Motion magazine. I'm here with physiotherapist and researcher Dr. Brooke Patterson from Trobe University at the Australian Sports Commission and Australian Institute of Sports Women in Sports Congress. Brooke, can you tell me a little bit about who you are and why you're here?
Thanks, Melissa. My name's Brooke Patterson. I'm a physiotherapist and researcher at the La Trobe Sport and Exercise Medicine Research Centre. Really excited to be here at WIS talking about female athlete injury prevention, and my passion is really implementation and supporting coaches and athletes to use best practice injury prevention. It's what I kind of do outside of work as well, with a bit of coaching in under 16 girls. So yeah, I did a research study on implementation and was presenting that at the conference this week.
What kind of interventions did you identify in your scoping review of dissemination and implementation of injury prevention?
We were interested in any type of injury prevention intervention, and as physios we probably straight away think about exercise and neuromuscular warm-up programs, which was a big focus, but we're also interested in personal protective equipment, so things like mouth guards, helmets, bras, face shields, and also policies and rules around, say, like early concussion recognition and policies around like concussion return to play as well. And we found a lot of studies, 220 in total across 81 unique sports. They were mostly team-based sports and mostly in adult and adolescents. We didn't really have a lot of children-based studies and not a lot of studies in the sub-elite space. We had a lot of elite studies, a lot of kind of community level, but some of those gaps were the children, the sub-elite, and also in other areas of the world like the Global South, we had less than 10% of papers in that area of the world.
What were the typical outcomes that you saw when it came to D&I? Were they generally adopted? Were they adopted well or badly?
So what we were interested in is looking at how well injury prevention interventions have been used and how it's been measured. And what we saw is that a lot of studies were looking at like coaches and athletes and their knowledge and awareness and perceived benefits of injury prevention as well, just had they given them a go. And generally overall that was really good, like 60 to 80% of, say, in a cohort said that yes, they're really positive about it, they know about it and they've had a go. But what was less examined was the confidence of, say, the coaches and athletes to actually kind of use the programs fully. And when it was examined, the confidence wasn't great. So there's a kind of real opportunity there for physios. The other thing that wasn't very well examined was fidelity. So actually, say, a neuromuscular warm-up program, like how well they were doing the actual types of exercises, the dosage as required. And we know like doing it well is really important for the clinical effectiveness. So again, a really opportunity for physios, I think, to support some of that fidelity. And then what was even less examined was the long-term kind of sustainment. And obviously that research is really hard to do. So only 26 papers out of the 220 actually looked at any kind of long-term outcomes. So again, opportunities there to kind of bring in the system of physios and the sport system and organisations to help kind of evaluate some of those longer-term effects.
What were the common features of approaches to D&I that were the most successful?
So a lot of, like I mentioned, a lot of the studies had really good like adoption. So when you put in strategies like workshops, online resources, websites, apps, modules, pamphlets, there was a whole range of different strategies and they all kind of did work in terms of that adoption. Maybe not so much that fidelity like I mentioned. So what we can really recommend is looking to the literature and the type of sport or what you're trying to achieve. If you're trying to achieve knowledge, then perhaps an online resource is appropriate, but if you're actually trying to like do behaviour change, you probably need a little bit more of that like active strategy where you're getting that in-person support and interactive, not just a once-off kind of shot of putting a resource up online.
How should researchers think about D&I when they're designing sports injury intervention studies?
Researchers need to think about implementation from the start and make sure that they're designing interventions. So the difference between implementation and intervention. Intervention is the thing, implementation is the strategy to get it out there. You really need to think about that both from the start. If we just design the thing and the intervention, then it might not be fit for actual purpose and implementation. So making sure it fits for the sporting environment or it can be adapted to the sporting environment. So that's kind of the number one thing. And then thinking beyond the intervention itself. So we, especially as physio researchers, we get focused on the exercises, and that is actually probably the easiest part. It's like, okay, well, how is this going to fit into the system outside? So actually talking to some of those people along the way, whether it's the professional bodies, whether it's the sport, the clubs, the leagues, the national sporting bodies, and go, okay, we're going to test this program, but actually after the research study stops, how is it actually going to keep living on? And I think, again, it comes back to that first point of thinking about it from the start. And then my third point is, if you are a physio getting out there and educating coaches and athletes, or you're in clinic or you're at a club, I would really encourage you to get involved. You have so much knowledge, and support coaches to have a go and support them and learn practically. That's how coaches learn the best. So go and do some education, but actually that practical training is probably what works the best in my experience. I think starting really early in life, so if you've got a young patient or athlete, the earlier the better. So even if they've got a small ankle sprain or something, actually getting them to think, and their parents and their club to think about injury prevention for, even if they're 10 years old, how can that club start that culture from an early age, so that as they go through the age groups, that it's just kind of normal routine business and part of what you do in sport.
Okay, great. Brooke, I'd like to thank you for taking the time to chat with me about your research.
Thanks, Melissa.